Oxytocin, the warm hug. Imagine yourself in the warm embrace of a loved one. A sudden surge of comfort fills your senses. A parent cuddling with their newborn, creating a connection that transcends forethought. These little affirmations of love can help increase oxytocin levels. Often referred to as the love hormone, oxytocin is released during times of bonding. Have a seat on this gondola while we discuss where oxytocin is produced, the regulation of production, major actions, and the consequences of oxytocin toxicity. As we get started on this ride, the first stop is at the hypothalamus, where oxytocin is produced. The hypothalamus links our nervous system and endocrine system, helping to maintain homeostasis. The hypothalamus regulates both the anterior and posterior pituitary glands. Next, we float on over to how oxytocin is moved by axonal transport from the hypothalamus to where it is stored in the posterior pituitary gland. This hormone is regulated by childbirth, nipple stimulation, and orgasms, just to name a few. Oxytocin production and secretion is regulated by a positive feedback mechanism, where release of oxytocin causes an action that stimulates even more release of itself. As this hormone is released, it targets smooth muscle, reproductive organs, and mammary glands. The effects on its targets are stimulation of smooth muscle contraction of male and female reproductive tracts, and stimulating ejection of milk. Now that there has been some quality time on the gondola, the cuddle chemical will begin to increase perceived trust of each other, promoting social interaction. This hormone not only increases relationships between couples, but also the necessary mother-to-child connection. It also initiates the mother's contractions of her uterus during childbirth and stimulates the ejection of milk from the newborn suckling. An example of oxytocin in a clinical setting is that it can be given intravenously, usually in cases involving childbirth, to strengthen uterine contractions. If the patient is given too large of a dose, this could lead to changes in heart rhythm, causing the heart to beat in an irregular manner, which in turn will create issues for the mother's recovery. In this presentation, we discussed that oxytocin is produced in the hypothalamus and stored in the posterior pituitary gland. Also, its regulation of production correlates to the reflex arc during childbirth, nipple stimulation, and orgasms. In addition to this, we reviewed the major actions of targeting smooth muscle contraction, reproductive organs, and milk ejection. Finally, we looked at the repercussions of when oxytocin levels are too high and how that can result in heart rhythm irregularities. In conclusion, oxytocin is an imperative hormone for our interpersonal relationships and is a driving force for pregnancy, through childbirth, all the way to nursing the newborn.